All right. Good morning, everybody. I hope that you are energized, caffeinated, because we are going to have a great time together. My name is Vanina Laurent-Ledru. I'm the Director General of Foundation S, the Sanofi Collective. Foundation S is the philanthropic organization of Sanofi. So thank you for being here at an early morning. It's an honor to have so many distinguished leaders and esteemed guests coming together to understand how we can collectively develop pathways to resilience, which we so urgently need if we're going to secure a sustainable and healthy futures for generations to come. So probably most of you, if not, I think you'll be pleased to know that at COP28 last year, there was a $1 billion pledge made by philanthropists, donor countries, to address the climate and health nexus. And this is a great step forward. But as we were reminded in an open letter that Foundation has penned with many other leaders in this room, it's just a drop in the bucket. And at the United Nations General Assembly just a few weeks ago, we made significant strides to continue understanding how we can advance financing for climate and health initiatives. But it is not lost on us that as we were all departing New York, then the biggest hurricane hit the coast of Florida. So this is just showing you that climate change is impacting health, not just in the global south, but truly everywhere on the planet. On the other side of the world, Save the Children, represented here by Dr. Revati Falki, have rang the alarm bell earlier this month. And we saw that more than 150 children have been killed in Pakistan with floods and heavy rain. So what we're seeing now, as I was telling you, is that there is still a big but in all the financing that's needed. We're seeing that there is a $366 billion finance gap between current annual funding for climate adaptation and the need. We are also seeing that only 10% of funding actually reaches local communities now. Now, it's not all doom and gloom, and actually we are going to discuss solutions. You will hear from amazing panelists here that actually are making progress every day for the people of their country, for the people that they serve, that there is amazing hope, solutions, and resilience. So what we finally come to understand is that health is not just about figures. And if there's one thing maybe that we've all learned in these past 2 days, is that health, as Dr. Tedros said yesterday, is about hope. It's about resilience. It's about a better future for so many of us and the underserved communities that we serve. So let's hope that we can inspire and learn from each other today. I'll come to the panel and see how we can bridge that funding gap, how we can create more pathways to resilience, and I hope you will be part of the discussion as well. So thank you and enjoy the discussion. Thank you. So I would like to introduce my marvelous panelists. I would first like to introduce Dr. Chiponda, Minister of Health of Malawi. So Minister Chiponda, you have been a firefighter, you have been a humanist, you have been a lone voice, but now creating much more impact in the global health discourse. You have taken global stages and you have reminded everybody that you can mobilize domestic, you can mobilize international resources to address the climate impacts that are affecting the health of the people of Malawi. So can you tell us more about what you are seeing and how you have been working at your level to address this climate and health crisis?
Thank you so much. Can you hear me?
Yes.
Excellent. First, let me really thank the World Bank and the GFF for organizing this event, and thanks for inviting Malawi to be part of this event. The topic we're talking about this morning, the climate and health financing, a very, very important topic to us from Malawi. For Malawi, I know most of the times we're talking about resilience, we're talking about building preparedness, that is preparing for the future. But where I'm coming from, we're talking about recovery, because we are already in a crisis. So I think that should be noted, that some of us really, we have been hit so hard. Malawi, we have had about 4 or 5 cyclones, which has really devastated the health sector and other equally important sectors as well. Because if you have crops washed away, there's food insecurity, it has an impact on health, because there will be malnutrition as well. And then disease patterns, they have changed, the burdens have changed. Malaria, we're doing so well in terms of indicators because of support from Global Fund. But now we are going backwards because the incidences of malaria, they're increasing. And this is not just normal malaria, including severe malaria. I think this year, almost 25 or 30% of all our hospital admissions, it was due to severe malaria. So, you know, malaria, for somebody who really doesn't understand malaria, when you have malaria, for you to recover, it's about 2 weeks. So you can imagine for somebody who's in the village, you have to go out every day to go and work, to buy food for your family. You cannot afford 2 weeks. And if the mother is sick, it means if she has a school-going child, that child is not going to go to school because they have to look after the mother. So it affects the whole household, it affects the whole community, and obviously it means it affects the economy of the country as well. So these are the real impacts. Now, my worry is that there's so little coming in to fight or mitigate the impacts of the climate shocks. I'm happy that you mentioned the 1 billion from the COP28. I was privileged that I was there for the Health Day. First, I'm saying issues of health and climate change, they should not be an event, because it's not an event. You know, an event, we're not going to achieve anything. They have to be part of the whole agenda. They have to be mainstreamed in the main agenda, not a day or a week or a month, no. The other one is that you mentioned the 1 billion. 1 billion, when we're coming out of the COP28, it was not clearly how that 1 billion was going to be used and who was going to benefit. Is it going to be a loan or a grant? So that is also an issue which I feel that as partners, we need to come out very, very clearly when we are supporting, to say, okay, we're going to support you building resilience and preparedness for recovery or for future shocks. But we have to be clear, give details. You know, you ask for accountability on government parts, we also ask for accountability on our partners' parts. I think it's only fair that accountability should be on both sides. And then there's so much funding which is in the climate sphere, but the conditions or guidelines to tap into the same. You know, if you're addressing a crisis, I should not take a whole year just to write a proposal. And sometimes to write a proposal, it means I also have to go maybe to Global Fund, say, can you support me with consultants just to put up a proposal? And to take a whole year. And then for you to get feedback when you have submitted the proposal, it's another 6 months or a whole year. Then you are not addressing a crisis. We need a sense of urgency. Because these issues we're talking about, they are real issues. There are real people who are suffering as we are talking now. So that is why whenever there's a conversation, and I'm happy for this conversation, that we need to have a serious talk, but when we have stopped talking, let's come up with the action points. We need to see change. We cannot be talking and talking, discussing and discussing, and then you cannot really see exactly where is it you are going, or are you making any advances or whatever. Thank you. Let me stop there for now.
Thank you, Minister. I think that we should applaud to that. I think simplification, accountability, and making climate change mainstream in all policies, these are red threads for this conversation. I will turn to you, Dr. Revati Falki. So you are with Save the Children International. You're the Global Director of Health and Nutrition based in the UK. But you have a vast experience with grassroots engagement and fundraising for climate-related projects. Your organization is actually currently implementing the first health program for the Green Climate Fund. And you are an accredited entity, so congratulations on combating and making sure that there is simplification for countries. So how can we bridge the gap between what communities need and what you are seeing in terms of decision-making about funding and policies?
So first of all, thank you for the opportunity for Save the Children to be represented on this panel, and really grateful for this opportunity. I think I will reiterate some of the points that Minister Chiponda has made. The first being, that understand the landscape, that where are the impacts, what are the needs. And of course, speaking from Save the Children's perspective, almost 1 billion children are living in high exposures to climate risks. So, it's not just about climate and health is important, but, the nuances of who, where, how much. I think that is the first step. The second is, of course, and both of you referred to it, the recognition of the funding gap. Again, within that, not just that how much of financing is less, it's also the quality of it, but also the percentage allocation of that available funding for the vulnerable groups. And of course, speaking from Save the Children's perspective, we've noticed that in the last 10 years, of the multilateral financing that has gone for climate, less than 2.4% of that was for child responsive programming. So it's also about what proportion the impacts are and how the percentage allocation of this funding is. Acknowledge the core challenges that organizations like us and countries are facing in accessing the finance. And I think we've heard this quite a lot in the last 2 days, and Minister Chiponda referred to it as well. The fragmentation, the difficulty in the access that we find, and of course, apart from being insufficient, it is also the difficulty in understanding the processes with which we can access this funding. Lengthy application processes, inflexible funding that is available, and disalignment to the actual timelines on where the finance is needed, the speed at which it can be made available in the front lines, and the scale, the proportion, again, allocation of what is available versus what really makes it to the last mile through organizations like ours and others at the local level. The risk of one size fits all and the siloed approaches. And that moves away from the localization and the contextualization that is really needed for adaptation action. So there is that huge risk that we see. There is, to some extent, an inconsideration to the local knowledge as well. That, how can we maximize, optimize, and scale locally available knowledge that we can incorporate into everything that is being made available. And again, the timelines. That in some cases we do see that mismatch between the short-term gains versus, the long-term resilience conversations, which require much more in-depth understanding, resources, expertise, and the political support to think beyond that time frame that, most of us are designed to think. So Save the Children, of course, advocates for increased funding, proportionate allocation of that for child responsive programming, but also taking a systems-based approach to financing, because we know that many of the determinants of health do sit outside of the health sector. So how are we going to leverage this two-way street for accessing finance outside of the health sector for bringing benefits for health? The other thing we are doing is we are also offering concrete platforms for the meaningful inclusion of community and children's voices. For example, we support participation of children in important events like the Africa Climate Summit, COP20, the COP28, COP29, and also one of the exercises that we saw in Rwanda was a mock COP for children. And I think that is an excellent way of creating future generation of children and adolescents who can meaningfully participate and bring their aspirations and perceptions into these important conversations. The other thing I'll say, and just two more things. One is, it's also about taking the approach of financing from risk to resilience. So at every step on the way, community representation of the voices of the vulnerable is important. It's not enough to do it at one point in time. It's not enough to do it in one phase of how we are responding to the climate emergency. It's taking that holistic approach, a life course approach to how we are doing that. So 3 examples from Save the Children. The first is the Generation Hope campaign that we ran, where we spoke to almost 50,000 children in several countries to understand what their demands were for climate change and action. The second approach we are taking, which is also a pre-step to our GCF proposals most often, is community-based systems mapping. And there it's basically participatory approaches where we work with the communities, we work with children to understand not just what the risks are, understanding what the options for responses are, prioritizing them together with the community, and also taking it all the way for, where possible, evaluating the responses that have been prioritized and implemented. So again, demonstrating that full screen. In terms of our GCF portfolio, as you mentioned, I'm very pleased to say that we are amongst the first entities to implement LAO, but which again focuses on strengthening the resilience of primary healthcare systems, community health facilities, for resilience of climate change. And fingers crossed, I don't know if GCF is in the room, but in October, hopefully we will have the next project with Minister Chiponda in Malawi, and that will be the second project, again, amongst the two that the GCF has allocated for health. And then we have two more in pipeline, coming Senegal and Indonesia. So again, yes, we are accessing these funds together with countries, but it's not enough, because this is 4 projects out of the need that we just heard. I'll end with saying that this is not possible without mobilizing co-funding from partners. And Foundation S is one example where we've partnered with Malawi. GSK is another example where we've partnered with in Senegal and other countries. So we cannot do this alone. And I think that partnerships is key, not just for mobilizing the access to the funding, but also in the implementation. So partnerships there when it comes to the localization agenda that we have of working with local partners, working with communities, and that's how we'll achieve scale. So thank you.
Thank you, Rivati. So yeah, I think if the Green Climate Fund is in the room, stand up because we want to make sure everything's confirmed in a few weeks' time. So. But great news for Malawi, we hope. And I think you mentioned the role of partnerships. I would like to turn to you, Dr. Monique Vleder. You're the head of Global Health, Nutrition and Population Unit at the World Bank. And you have been a tireless advocate for climate and health financing to increase healthcare systems resilience. You've been supporting partnerships left and right to really accelerate the movement. Can you tell us how the bank has been increasing its own health and climate efforts, and what is it about this new approach that has been started about a couple of years ago?
Right. Thank you so much. Really delighted to be here, and also very happy to see the Honourable Minister from Malawi. I think you really defined the problem so well in how you describe what you're experiencing. When we talk to countries, and the World Bank has health programs in over 100 countries, we see a very wide range of issues, and not always even those issues that are impacting health are defined as climate problems, but when we start exploring them, they are actually have a climate origin. And this ranges from an increased demand for primary healthcare services, massive outbreaks of infectious disease with all kinds of different diseases. We have 22 countries in Africa at the moment that have very severe cholera outbreaks. It's weather events disrupting supply chains for commodity or flooding health facilities. It's different demands on health workers that are already in very short supplies, and it's because of all that effect. And nutrition, I have to say, is a really big contributor, and of almost 50% of all deaths that we're seeing in low-income countries is related to climate. Heart diseases, I can go on, right? And so when you look at the scope of the problem, it really requires a very comprehensive approach, right? And we cannot look at this as a one-off. We need to look at how the whole health system will adapt to be able to respond to this effectively. And as my colleagues here have said, this is not something that one organization can do by itself, but we're trying in the World Bank to also make our commitment and our contribution. And we do that through the following steps. First of all of the World Bank financing, not just for health, but beyond that, 45% of our financing is climate related. And I'm really, really happy to say that for the health portfolio at the World Bank, which is roughly $35 billion in financing, we are already at 50% in terms of our pipeline financing and making our health projects climate responsive. And so that's the first one. And then the second one is our President's commitment to health by announcing a doubling of our effort. And we want to reach 1.5 billion people by 2030 with health services funded through World Bank programs. Last year, we met at the COP28, where we launched our climate and health programs. We set out to work with 40 to 60 countries in the 18-month period after that to do diagnostics. We're well on our way to complete that. And these diagnostics are really important because they are country-owned, and they give countries the ability to look at the data and see how climate is really impacting health and how health systems need to be adapted to be more resilient to that. And that then leads to much better adjusted World Bank projects, but also influencing government financing. And I'll give one example of a very large program in Nigeria where we worked with Minister Pate to do this kind of climate and health assessment, really influencing his overall sector-wide approach for primary healthcare. And the World Bank itself made $600 million commitment to this primary healthcare program that is climate resilience, but the government themselves put in the largest share of funding, right? And this is where we collectively can help support national level policymaking and national level allocations that really make the health systems more responsive to climate. And maybe add two other sort of frontiers here is that we're deploying all of our financing tools, so not just IDA and IBRD financing, but also private sector investment. It plays a really important role. We do need grant funding for innovations that we can then scale up with our financing tool. There's a real demand for technical assistance and support countries with the sense of urgency to really quickly do these diagnostics and ensure that we have the financing behind these comprehensive programs. So we're excited with the progress. A lot needs to be done, and we're in this together. Thank you.
Thank you so much, Monique. So I think you hear it from our fabulous panelists that there is a clear sense of urgency. So now I'd like to come back to you, Minister Chiponda. I think we are gathered here in Berlin. You have a lot of funders, not only on stage, but also in the room and running the corridors. What would you like to ask in terms of increasing the predictability, the transparency of funding? What is missing, and how can we best help?
Thank you so much. First, let me express our gratitude to World Bank, GFF, and Save the Children, and many more, even German government, for the support which they're giving to Malawi through the ministry, and some of it is to help us to, recover and also to strengthen our health services. So I think for us, these ones, the ones I've mentioned, World Bank, GFF, the beauty is that when they come into a country, they align themselves to the government's plans, which I feel is very, very important. Because sometimes when you get a partner, but they're already set on what they feel they have to do to assist you. And then it creates parallel structures as well. So I think the one thing I would ask is that, like for Malawi, now the health strategic plan which we're following, we are saying all of us, we need to go by one plan. So it's a one plan, one budget. We are pulling our resources together, and then we have one monitoring and evaluation. We do it together. So the one thing which I can ask is that when we go into a country, let's align our programs to the country's program. In that way, you want the countries to have a sense of ownership, because at the end of the day, you are assisting us. So we need to have a sense of ownership, and also to make us more accountable to how are we utilizing the resources which you have supported us. So that is one message which I have for all the partners who are there. And I'm calling to action as well for them that indeed we need help, and we need help now. Thank you.
Thank you, Minister. I think that's very clear. One plan, one budget, but you take the responsibility on your side as well, and it's clear that it's a two-way street. Talking about this, Dr. Revati Falcao, coming back to you, you have been working on making sure that you can support national adaptation plans and build a health chapter, as is the case in Malawi or already in Laos. So can you tell us more about the unique role that civil society organizations are actually playing to drive this climate and health agenda forward, knowing that it should not be about creating additional layers?
Absolutely. So I think from a policy and advocacy perspective, as I mentioned before, we talk about what the costs are or what the gaps in adaptation or the funding gap that is there. But at the same time, I think we also need to bring focus on the cost of inaction, particularly for health. And this is also something that we will advocate for the indicators that we are developing at the moment, that yes, it's important to see how much we are going to need, but it's more important to see how much we will need if we don't act now and if we don't act at scale. The second one is also to rally, advocate and rally all the stakeholders around to review and optimize available funding, as I also mentioned before. Yes, it's about the flexibility of access. Yes, it's about the scale, the proportion, but it's also the speed, as Minister Chiponda said, the speed at which we can mobilize this in the front lines. I think that is something which is critical, that we as civil society organizations can, as a joint voice, elevate these into policy spaces, into decision-making spaces. I think it's also, again, about adequate representation of vulnerable groups in key platforms that we mentioned at the global level, but also at the local and the regional level. We've ourselves observed that majority of this decision-making, majority of these discussions, whether it's for global health, whether it's for climate finance for health, health finance for climate, majority of these key decisions are, trickling down still. And that reversing of the pyramid, and saying that primary healthcare is where we should be prioritizing these actions, and that's how we're going to achieve the scale argument. In terms of practice and evidence, of course, we hold our own evidence. So, like you mentioned as well, Save the Children is present in about 113 countries. We have health, nutrition, WASH programming in almost 66 countries from a developing perspective and 54 countries from a humanitarian perspective. So huge evidence that organizations like ours are holding from how we can, optimize the programming, already existing programming for health interventions, and how can we make that climate sensitive. And again, that scale argument, that for anything to reach scale, that is where the majority of the action needs to be there. I'll end with saying knowledge generation and, most importantly, mobilization. So, sharing this. So all the countries that we are establishing now a GCF, a community of practice, given that we'll have 4 of these projects, fingers crossed, 2 at least, which will go, but learning from each other, and having some kind of standardization in how we are implementing our climate projects, so that we have that evidence, which gives you that argument and the ammunition to mobilize scale for multi-country projects. So, having that mobilization of expertise and knowledge that is being generated. I'll end with saying that civil society organizations play a critical role in the accountability aspect. That, are we holding ourselves accountable for whatever I'm saying now? That, in a year's time, have we implemented the ambitions that we have said, or the things that we considered to deliver? And then, using that peer strength to hold other stakeholders accountable for what we are collectively setting the ambition for, and how fast we are delivering on those ambitions. Thank you.
Thank you so much. So, Dr. Leder, I'll come back to you. So, you have mentioned the centrality of partnerships, and we heard this word in the words of our other panelists. Can you tell us more about the World Bank efforts there? How are you actually synergizing efforts? How are you building a coherent roadmap to accelerate financing pathways?
Yeah. Great, and there are different partnerships with different objectives, and so maybe first to talk about the need for the skill of financing, as the Minister also really emphasized that urgent need, and so we're co-chairing with the Asian Development Bank, the Regional Development Working Group for Climate and Health, really collectively looking at what do we define as climate and health, how as development banks do we respond to that, and how do we bring more alignment and skill to financing, and we're planning, Indonesia was one of our pilot countries to do much more joint financing around climate and health priorities. And so then on the one sort of process where we have a diagnostic tool and planning, and we work with governments, ministries of finance on the health system investments and ministries of health, that will be then one collective alignment of financing to co-financing into climate and health programs. And so, and really these are health system investments that we can collectively make, bringing more skill to the financing. WHO plays a really important role, and we have very close collaboration between the bank and WHO, and we're very active in the attached network, which plays a very important role. You cannot underestimate the role of the private sector, and so we want to bring more definition, priority, focus to that, including under the leadership of our president, bringing the private sector arm of the World Bank closer to our health objectives, and there's a lot of scope and opportunity there, particularly also on mitigation. So I think civil society plays such a crucial role, so I just want to emphasize that. One of the main bottlenecks we're facing in supporting and financing is the challenges with health workers. And so if you think about running a restaurant without having staff, providing the services or cooking for your customers, you wouldn't open that business, right? And that's the reality in many rural facilities. And if we don't address that, how are we going to help support this increase in demand for health services that we're seeing as a result of climate, right? And that has a community arm to it. And we want to work very closely on bringing community health workers more into the workforce. A lot of them are women. It's a gender issue too, but also working with local community groups and with civil society to make sure that this is a national response and not just a government response.
Thank you so much. So stay with me for one short sentence. We actually want to use you in the audience, and we want to move from ambition to action. What's your one sentence to invite our audience to action to support the climate and health financing agenda?
In one sentence?
One sentence. And if you want, you can even get one word.
Or maybe say it like this: we are all leaders from whatever position we are in, and so use your leadership for the same goal.
Thank you. That is very powerful. Revati.
I would say mindset reset. That we will not achieve this if we don't have a whole of government, whole of society approach, and definitely not without walking the talk. So everything we say, we have to do.
Thank you, Revati. Minister?
This is an appeal to the global community to unite in addressing the climate health crisis through collective action and long-term investment. Together, we can walk far and we can walk fast. Thank you.
Thank you. Thank you. Thank you for indulging me with that last question. I think it's always great. You can hear from our distinguished panelists that they speak with their heart, they speak with their minds. And with this, I would like to invite you to get back to your seats. We will now move to part 2 of the program, for which I will change seat and invite Tjedu Moyo to the other part of the stage. So this is a very dynamic Hollywood-like setting. I hope you appreciate that the World Bank and our partner of the German government are making you feel like you're in Los Angeles. Tjedu? Thank you so much for being here with us today. It is a pleasure to have you here. So I would like everybody to meet Tjedu Moyo, who is the founder and executive director of the Lunia Center for Youth in Zimbabwe. And this is an organization that really acts as a hub for young people to collaborate on climate change, for them to understand how they can impact public health. So can you tell us more about this organization. Can you tell us more about your experience engaging the youth? And I will continue with a few questions if that's okay. Thank you.
Okay, thank you so much. Like you said, I run an organization called the Lunia Center for Youth. And what the Lunia Center for Youth did in the beginning was to help adolescents and young people access reproductive health services. We're talking about reproductive, sexual, neonatal, maternal, child and adolescent health. And we do this through offering comprehensive sexuality education, working with them in the community, and also just opening a space for them to have the conversations that they want to have, also because of the environment that these young people are in, and also do work around advocacy, and also just conversations like these ones where we just bring into light the challenges that they face, and also maybe mobilize resources when we can. So this is the work that we do, and as the Lunia Center for Youth. Thank you.
No, that's great. So it is a beautiful organization. There are many videos on the internet, so you can also check it online afterwards. So can you tell us, what are you seeing that the youth is understanding about this issue of climate and health? Are you able to discuss financing as well? Is this something that you are looking into with your organization?
Thank you so much for that question. So the Lunia Center for Youth was founded in 2020. Mm-hmm. And I think that was during the peak of the COVID-19 pandemic. And as we moved from 2020 going forward, we realized that when we talk about public health, when we talk about reproductive and adolescent and women's health, there's a lot of social determinants. And in the conversation that we're having in the community, we realize that the changing climate, the environmental degradation, and all the challenges around the environment and people's health were coming up. Like you could not talk about accessing contraceptives or raising a healthy child without talking about the nutrition, without talking about proper sanitation. So this is when the conversation around climate and health started coming in for the organization. And when they started coming in, we added a pillar to say we also need to talk about climate justice as an organization. But when we talk about climate justice, because we are at a local level, I think one of the panelists earlier talked about localizing and contextualization the conversations around climate and health. So this is the conversations that we're able to have, but we are having them at a local level. We're talking about access to water, we're talking about access to adequate nutrition, we're talking about access to sanitation. But then when we talk about those issues, we are also trying to raise awareness and do advocacy. But the challenge that we are having now is we run the risk of climate conversations are held in silos. Like it's like when we're having conversations around climate change, we don't see that when we alienate climate change and say, oh no, we are financing climate change, it's also a determinant of health. So you find that as the public health activists, as the women, the children, the girls that want to have comprehensive health services or equitable health service delivery, they are not part of the conversation. So we end up just having those conversations as us. So I think at the moment we are trying to have the conversation, but we are running the risk of the climate conversation being held in silo, and then when we talk about health, it's like we're talking about health. But unfortunately, like what the Minister of Health in Malawi said, to say that when we are talking about access to health services, we need to use the public health lens so that we can be able to not run the risk of alienating one challenge from the other and still facing challenges in the future. Thank you.
No, I think this is a very, very important comment. You're inviting us to think about really having a holistic approach. Are you seeing that youth representatives are involved enough in participatory mechanisms to ensure that the climate conversation is not siloed, as you're seeing? Are you seeing, I don't know, youth advisory boards? Save the Children mentioned Generation Hope, for instance, as a campaign. Are you seeing some of this effective, or what would be your recommendations to include youth in these mechanisms?
Thank you so much for that one. I would say it's when we talk about youth participation or meaningful youth participation, I think in most cases we need to look at the participation of the young person. I like to say the end user of the product, the end user of the health services, the end user of the health center, the end user of the health policy. From start, when the policy is being planned to implementation, and it doesn't need to be something that is only for celebratory purposes, for pictures. We need to see these youth advisory boards being taken from start to end. Like, for example, when we are developing the national adaptation plans that are being developed worldwide right now, we see young people just getting consulted, like it's the one-day consultation, and then after the consultation, it's like it's over. Somebody else goes to plan what is going to happen with, with all the things that need to happen with the policy. So I think it's important that when we engage with young people or when we engage with the end users of the policies that we develop, even in terms of when we try to unlock financing, we have these people from the start towards the implementation, and even at the end when we're now monitoring and evaluating the policies that we're having. Why is this important? This is important for sustainability, so that these people, they are a part of the journey. And this is also important for the ownership of the process. Like, they don't feel like we are imposing these policies or we're imposing these recommendations on them. Like, remember, I say that if we don't do that, we run the risk of alienating these two important climate and health, these two important catastrophes that we are facing. So we need the young people, the end users of the services, of the health information, of the infrastructure, of the health infrastructure, to be there from the beginning to the end. And as we do that, we need to be very, we need to take into consideration that these young people, they are different. They are young people that are educated. They are young people that are not educated. They are young people that can understand, the English language that we are speaking now, but the young people that don't understand. So also our role, what is important is for us to then come down and localize and contextualize. I think this is where the CSOs come in to say, we want to talk to, because remember, if we're talking about Africa, we are talking about, because I come from Africa, I'm gonna use Africa as an example. We're talking about communities that, have a high illiteracy rate. So when we're saying we're making policies to deal with the climate and health challenges, and we haven't consulted the bulk of the population that we are making, these plans for, because they are not educated, then we are running the risk of we're not doing anything. We're actually creating more pandemics. And the painful thing about public health is that what we ignore now becomes a pandemic in the future. And when it becomes a pandemic, we are not prepared for it. It becomes another challenge. We have to talk about unlocking resources, whereby we could have, from the beginning, had a comprehensive conversation. So I feel like this is where the CSOs come in. This is where youth-led organizations like us come in, because what we use is a local approach. So it's very important to take those principles into consideration, and most importantly, have the young people, have the end users of the products, the women, the underserved women, the children, or everyone else, not just for them to come maybe and just have a conversation, but from start to say, at the World Health Summit, we talked about we want to unlock resources for climate and health, but what does it look like? In your context, what does it look like for a young person in Zimbabwe? What does it look like for a young person in South Africa? Because the contexts are different. Thank you.
Thank you so much. I think this deserves a warm round of applause. So everybody, I give you Chedu Moyo. I think you have a powerful engine to ensure that youth is adequately represented, that you can share the passion, the knowledge that you've amassed in Zimbabwe as well with many other youth-led organizations. Please stay and go speak with Chedu Moyo, because there's a wealth of knowledge that is actually stored next to me that we absolutely need to ensure that we tap into. So with this, I will invite you back to your seat, and we will have now our second panel. So thank you so much. So I'm transitioning again to the other side of the stage, and I would like to invite Dr. Ethel Maciel, the Secretary of Health from Brazil, to the stage, please, here. I will invite Dr. Dirk Meyer. I will introduce you. Claire Bonnel, please join me on the stage. And I'm changing seat. No, I'm back. Perfect. Okay, so we have our second panel complete now. So I would like to start with you, Dr. Maciel. So you're here coming from Brazil. Brazil is very busy already preparing COP30. You yourself have been developing a lot of climate and health interventions in Brazil. Can you share more about the innovation that you are seeing and what you are leading in your country?
Thank you. Thank you for the opportunity to be here. Brazil right now is with the G20 presidency, next year with the BRICS presidency, so it will be another busy year. Right now we are trying to build this resilient health system in Brazil. And I think it's very important to think that to be a resilient health system, you have to be a health system. So in the last 30 years, Brazil was building the universal health system. And right now we are looking what we need to erase for this universal health system. And since this new government, since the President Lula was in place, the main priority is the Amazonia region. We realized that we have more than 300 ethnicity for indigenous people in Brazil. Each one speaks their own language, so, and more than 100 don't speak Portuguese. So this make for us in the health system with a lot of challenges. We have to build the health system in a different way. And right now, since our Minister Nisia was leading this new project that we are looking in the Amazonia region to see the empty space, where we can, what we need to do. We realize when you are in the Secretary of Surveillance that in some area can take us like 100 days for one exam to come back to the physician when we are. So we have because in some part of the Amazonia region, we only reach them by river or by airplane. It's a complicated area and with difficult access. And right now, what we are in some part we cannot building a health unit, for example, because it's a protected area. We cannot construct nothing there. And we have to be a very creative. Mm-hmm. And right now, what we are looking is to see in each area how we can have like a mobile lab, a floating health unit. So it's a completely different way that we have for the other part of the country. So we are in the last 8 months working this program that will be launched for our minister and talk to the community. So this take a lot of time to build because it's easy when we are doing this by our cabinet. But when you are going to the community and listen them and see what they really needs, takes more time, but it's more efficient in the end. So this is what our priority right now in this area, in the Amazonia region. And this is very combined with the other program that we launched this year, in the beginning of this year, that we call Health Brazil, with the focus on the social determinant disease. And we have a very different indicator from these communities, the indigenous population, the Afro-descendant population that lives close to the rivers in Brazil, and in some specific communities that we call quilombolas. The indicators are very different. We have not only one Brazil. We used to say that we have like a lot of Brazils, and with different indicators, with the white population and Afro-descendant and indigenous population. So the priority is looking inside the country and build the program looking for this diversity that Brazil has.
Thank you, Dr. Amaciel, for taking us to the river of the Amazon and understanding how important it is to localize and contextualize, as we've heard it before. I would like to turn to a different part of our panel. I would like to turn to you, Claire Bonnel. You're the Senior Vice President for Global Strategic Partnerships and Access to Care at Siemens Healthineers. And you heard about the situation in Brazil. We heard about the situation in Malawi before. You are working as part of the private sector and developing innovation. You can tell us a little bit more about how the private sector can be a driving force on innovation to spur climate change mitigation and health adaptation. What innovation have you seen in financing? What innovations have you been working on yourself to address those challenges?
Thank you, Vanina, and thank you all for being here. It's really a pleasure also to be speaking here alongside the fellow panelists. So maybe some of you wonder why a company like Siemens Healthineers, a medtech company, would care about climate and health. So maybe let me start by bringing some additional context here in the conversation. So we know that approximately 3.3 billion people already live in areas that are highly vulnerable to climate change. But at the same time, we also know that it's the same people that do not have access to essential healthcare services. I've recently been to Brazil, actually, and it's great that we have a chance to talk about the Amazonias now, because access is also a big issue in Brazil, and I've seen it for myself. We are lucky to partner, actually, with the government of Brazil on a project for the Amazonias, where we're trying to bring 5G networks to enable the ultrasound exams and be able to turn around the images much faster. So when we're talking about access, we're talking about people that actually do not have a facility nearby, that do not have a health workforce, a health care professional that can care for them in the near vicinity. And the problem with the access issue is that it's only been heightened and accelerated by the climate crisis. So as we think about climate and health as interconnected topics, I think we not only have a responsibility, but we also have an opportunity here to do better. And I don't want us to leave the session thinking that it's all negative and pessimistic, but on the contrary, we have a possibility here to do something great. So I think as we collectively design the solutions that address the negative effects of climate change on health, I think we have an opportunity to build the healthcare systems that are resilient and sustainable. And you've also heard it in the first part of the panel, where health systems are the key here. I think we also have an opportunity to build equity within our solutions, placing people at the center of the response. We've been talking a lot about policies, about potential solutions, but at the end of the day, what matters is the real impact we can have on people, and make sure that we respond to all disease burdens at once. The other opportunity I see is that we can also bring innovation. So thank you for raising the aspect of innovation. I think innovation in itself is not a tool that we should see as a standalone thing. We have innovation, it's great. How can we bring it absolutely to low and middle income countries? I think the question here is, how can we accelerate impact by using innovation? Where can we leverage innovation to reach those that need it the most? So on that, I will actually challenge everyone that we think about this as the problem. The problem is, how do we impact communities? How do we impact marginalized, vulnerable populations? And how do we accelerate our impact? In that regard, I think businesses, we are catalysts for economic growth. But I think we also have an opportunity here to build and accelerate social and environmental resilience and impact. So if I look at our own ambition at Siemens Healthineers, by 2030, we would like to reach 260 million people in underserved communities living in low and middle income countries. but we also want to ensure that the care that we deliver is high quality, that it can be sustained over time. And for that, we will seek to provide 6 million hours of training to healthcare professionals through education and professional training. But I wouldn't be here as heading partnerships for the company if I wouldn't talk about the importance of partnerships. We cannot do this ambition alone. We cannot meet these objectives by ourselves. So I would really call on to hear the audience and fellow panelists that we look at partnerships across sectors, across diseases that really help move the needle. I think collectively we need to break down the silos that we've seen in the healthcare space for the last 15 or 20 years and really look at working horizontally across topics and sectors. One other aspect I would like to mention is I have the impression that we've always been working in sort of an emergency mode when we are facing a crisis. So we are always trying to deal with the crisis during a crisis and after the crisis. We're not thinking enough about the healthcare systems that are really needed to shape the future for populations not only to survive, but to thrive. So I think if we look at that, we have to look at building the strong health systems that we need for tomorrow. And maybe coming back now to your question around financing. I think as a global health community, we have a responsibility here to make smarter investments that are centered around the needs of the populations and underserved communities. So in my opinion, that means addressing climate and health together. Health and climate adaptation should be embedded in everything we do. It's a non-negotiable consideration. We should include it in the way we develop financing mechanisms. And if I now just touch down a little bit on financing mechanism more specifically, I think they would only be as successful as the impact we are trying to reach. So one question here that I would like us to keep in mind is, how can we continue to provide healthcare to 8 billion people around the world when we face a massive healthcare workforce shortage, nearly a third of the population is affected by climate change, and at the same time, these people do not have access already now to quality care. So, in my opinion, I think there's an opportunity here also to learn from the innovative financing tools that have been used over the last 15 years in climate and health alone, and leverage these learnings to propose financing mechanisms, whether it's green bonds, social impact bonds, blended finance, you name it, to support both climate resilience and health needs and respond to that question I raised earlier. I think innovative financing mechanisms can unlock the capital that we need. We've talked about the funding gap, that's definitely critical, but it can also help us optimize the use of resources. But I think, again, the question here is, how can we be successful to make sure that we accelerate the impact and really reach the communities that need it the most?
Thank you, Claire. So, clear call to action in terms of developing and deploying innovative financing. I will turn to you, Dr. Dirk Meijer. You're the director of the Multilateral Department of Development Policy, Transformation and Climate at the German Federal Ministry for Economic Cooperation and Development, in short, BMZ. As you can see, I don't speak very good German, so can you tell us a little bit more about BMZ's core strategic objectives when you are making investments in climate and health initiatives? You have been developing a very ambitious and aggressive roadmap. Enlighten us and share with us as well the successes that you are seeing.
Yeah, thank you very much. First of all, there is a German saying, not to put the wrong feathers around your head. So I'm not a doctor, I'm just an ordinary man. This is the first thing.
We should all be doctors when it comes to health.
Secondly, let me start with one half professional, half a personal statement. When I listened to the first panel discussion, the fireside, and what I've heard right now, we see first of all, that again, and we are very much like-minded in that the climate threat, the climate challenge is the biggest challenge of our century. It affects everybody, and we heard from the Honorable Minister from Malawi that we are not talking about a crisis coming up, but she said, as it is, we are in midst of the climate crisis. And if we look what is going on at the moment, our concentration on wars, our concentration of armaments, this is one of the biggest things we have to stop, because it deflects us from the real focus for mankind's challenge. That's the first thing. And as I said, it's partly a very personal statement, because the more I think about that, the clearer it comes to me that when we talk about the lack of funding, the lack of focus, we do know that we are too much deflected on that. So that has to be in the center of everything. Allow me that
of course.
In the beginning.
Very important remark.
Thirdly, I think it came out quite clear, and I try to link a bit the panel discussions with each other, that after a couple of years, we will try to find out, as Monique said, what are the issues, and do they have a common frame to find out that all the different issues we have, from floods and droughts and insecurity in food and so on, are related to the question of climate. Since we have understood that, we are now building up, with the help, for instance, of the World Bank, the knowledge bases, link that to local authorities, national authorities. That's good. And we are very much like-minded in that. That's great to have this fundament now. When it comes to what I have to do in the German government, in the BMZ, in the Ministry for Development and Economic Cooperation, of course my focus is, on the one hand, climate and climate-related problems, but of course always with the question of development, and trying to bring that together. So take the climate discussion out of what we've heard in the first panel too, take it out from the silos. So the BMZ is talking with the partner countries about what can we do when we talk about mitigation to combine that, even if we talk about adaptation, in my opinion, to combine that with growth, with quality growth and chances for the emerging societies. So in that, we try in the BMZ to focus all our policies on that. So when we talk about supporting the partner countries in their economic pathways, combine that with the green transition topics as part of the mitigation. Of course, we support from the German government all the institutions that are working on that. So when it comes to the UN agencies, when it comes to our engagement as being governor, the BMZ being governor in the World Bank, the reform process of the World Bank, as part of being governor also in the regional development banks, supporting that and trying to help making climate-related topics, climate and health-related topics as a mainstream in the agendas of these institutions. So in that, it is great to see the reform process, not just of the regional banks, but also of the World Bank, but also to see that the IMF refocused and saying climate is not something beyond financial topics, and when we talk about debt, of course we have to talk about climate. So that's our role. And sometimes we have to be very nasty. Just to take one topic, we talked in the first panel about the question of resilience. Social protection, adaptive social protective measurements are key to build up, especially in the most vulnerable groups, resilience potential. But when we talk, for instance, to the New York-based UN agencies, we do see that we have a lot of silos in that all of them have a programming on social protection, they're not talking to each other, and even they're not really talking to the World Bank Group. And we try to push forward these kind of topics. When it comes to the access to money, we heard about that in the first panel too, about the green and planetary funds. Germany is a big donor, but we have to play much more our role of being a donor in that and trying to build joint programming to push forward a much better access to the projects, to reduce the time for the proposals, to speed up. That's really just a few examples what is part of our attempt to break our silos, but to be very honest, of course, we also have to do a lot in that. I'm from the directorate dealing with the multilateral institutions, the question of financing and the green topics, but I have a silo when it comes to my colleague in the other directorate that is dealing with health. So even we have silos. What we've heard this morning is that we have to do things that we are not trained in. We are trained in silos. All of us are trained in silos, in build up special funds, in build up special schemes, and so on. But the question of joint programming related to one big topic, that is not what we learned. And this is a question also of, I think you said it, Save the Children, reset the mindset. This is a pure administrative topic, which is very, very complicated because the budget systems, the systems of the ministries, the systems of the multilateral institutions are not trained for joint programming, for joint building up. And that's part what at least we try in the ministry, in the BMZ, to push forward. But I'm a marathon runner. I would say we are at kilometer 10, but not yet at kilometer 42.
So thank you, Mr. Meyer, although I will call you Dr. Meyer for the rest of my life, probably. Dr. Maciel, I would like to turn back to you, to Brazil, because we heard that we are at kilometer 10. You were telling me yesterday how Brazil has put climate change in all its policies and how it's driving governmental action. We heard from Mr. Meyer how important it is to break silos. Can you tell us more about where you are at with building an integrated approach and how you've also been able to mobilize climate and health financing for the benefit of populations? And the reason I'm asking this as well is because many studies now have shown that when you invest $1 in health, it actually yields 4 in economic return. So it is also the best development case to be made. So, Dr. Amaciel.
Thank you. First of all, I think what we are doing in Brazil is to think outside the health sector, not only health sector, because now with this commission that we have from the government, with all the ministers sitting together to think about the climate plan for Brazil, it's important. For example, sanitation, it's from the Minister of Development and Regional Development in Brazil. But we, as the Minister of Health, we have a seat to tell them, this is important, we need to sanitation this area, not in this area, because the budget is limited, and we have to choose what we will do the first. And health is an important player in this committee. So we have to think that everything has to do with climate. And when we are in Germany and we go to a jewelry and buy a gold ring or something, there's a miner that this came from. And probably is the miner in Amazon region that has a lot of mercury poisoning to the children in the indigenous population. So it's not about only army. It's about the way that we are, that we build our society. There's someone that is in a very bad condition to us to have something. So you need to think about this. And probably, and most likely, these people are in Africa or in America. So when we make our choices in Europe, in the United States, we have to think about this. The North and the South Global, we are completely linked. And right now in the G20 in Brazil, what we are saying that we need to build a better world for all of us, not for only a part of the population in the world. So in the G20 that we have this possibility to have the South and the North Global together, we are putting this conversation on the table that we need to think in a declaration for climate change that look in our unequal world and think that in the most vulnerable population, in the most vulnerable country, we need to think about this. Brazil was in this G20 with the financial minister asking for the pandemic fund to have a difference rate for countries that has most impact for climate change. So we have to have different ways to look for the different countries and to try at least to make our difference less than they are right now. Otherwise, we are only talking about climate change, but didn't make any difference in the people's life, that in the end of the day, this is the most important. So Brazil is taking this leadership in G20 to put equity in the center of the agenda for the climate change.
Dr. Amaciel, thank you so much for reminding us the importance of empathy in these global conversations. It's very critical to discuss policy and how we can advance the agenda, let's say, at somewhat theoretical level sometimes, but you are grounding us, you are reminding us the importance of walking in the other person's shoes. Quick question on the Troika that you've built up with COP28, COP29, and COP30 that you will hold. So UAE, the Baku presidency of COP29, and yourself that is coming up. Do you want to share already one or two indications as what your key agenda items will be about?
We are talking with the Azerbaijan in the COP29 right now. We are trying to launch there. We are work in progress, launching in the COP9 resolution or declaration that health will be a priority in the next COPs. And in the Brazil agenda for COP30, we are working. Is a work in progress, but the most part of our COP30 will be talk about the needs of the preservation of the forest that we already still have in the world. Probably the next pandemic will come from one of the spillover from this environment, so it's very important to protect the people that live in this place and to protect the forest that we still have in the world. And this will be one discussion in our G20 in the end of October that we are called for some indigenous leaders to talk to the audience of the country. And the Amazon will be in the center of the discussion because for the first time the COP will be in Amazonia region. So this is our priority.
Thank you so much. So very important to understand how we can break silos across human health, animal health, you just mentioned, planetary health. Claire, I would like to turn to you because we've heard about G20, we've heard about COP30, all of those discussions that are led by governments. How can governments create an enabling environment that actually fosters long-term collaboration, but also investments from the public and the private sector?
Yeah, it's a very good question, actually. I think I'm really amazed, actually, by the commitments we've seen over the last few years and the leadership we've seen coming out of Brazil, of Germany, with the One Health approach, and really looking at this comprehensively, really looking at climate and health together and seeing how we can tackle this at once. So I really welcome the political leadership we've seen over the last few years, the declarations coming out of the G20. I think these are really important mechanisms to set the political framework around us. But at the same time, I think we're all here because we do have shared interests around breaking these silos and really looking at it collectively. So I'm thinking, we've signed the SDGs many years ago. We are all here because we believe in that. We believe in the power of addressing climate and health together. But how can we actually translate all of this into action? I think that's my main question here is, how can we make public-private partnerships in a way that translate the political commitments, the leadership we've seen, the global commitments overall from the community to action and impact for underserved communities around the world. So I think if we look at public-private engagement and partnerships there, I think traditionally it's been really hard, I would say, for the private sector to engage with the public sector. There's been a couple of good examples, and we've seen some great results. But I think we can do better here as well. We can make it a little bit easier. We can make it more streamlined for all stakeholders to come together and really break the silos across the sectors as well. So, I'm thinking, okay, public-private partnerships where we can scale solutions, where we can think about, okay, what is the next health system that can be resilient to climate change? What is the innovation we can bring, whether it's digital or artificial intelligence, that will, in the end, impact the communities that we want to reach? So there's a number of mechanisms there, we can talk about also blended finance or other things, but at the end of the day, I think it's really looking at what does each of us bring to the table? Where can we have that complementarity, that additionality also? It's another concept that's been talked about in global health right now, to make sure that the investments that come from the different stakeholders can actually be leveraged strategically. We can optimize the use of resources and really think about, okay, if we didn't have public and philanthropic investments into that project, private capital would never be unlocked. So where is that key that we can turn to really make sure that we have the partnerships that we need for tomorrow? And I will just finish that with the last comments around, again, the expected outcomes and the impact we want to reach. I think, there's no need for public-private partnerships if we're not reaching the impact. I think the key question here is, what is the impact we want to achieve, and how can we build the partnerships that can support and enable that?
Thank you, Claire. So talking about impact, Mr. Mario, I'll come back to you. One last figure, and I don't want to depress everybody, I want to invite everybody to action, but the adaptation gap for climate and health-related issues in the Global South is currently estimated at $11 billion. You have told us about how you are embarking on this new roadmap and all the work that you started to do at BMZ. Can you tell us more how you are mobilizing new funding? Can you tell us more how you are developing new pathways to increase financing and accelerate the bridging of the gap?
Yes, it's complementary to what you said, I think. At the moment in the BMZ, of course, 80% of the German contribution to our fair share for the public money for climate finance is coming from the budget of the BMZ. Mm-hmm. So we are key in that, and half is concentrated on mitigation and the other half is concentrated on adaptation. But nevertheless, my point is not to do some kind of advertisement now, but your question was, what are we doing to mobilize more? Because we all know that much more money is needed. It's on top of our panel discussion. And in that, we learned from the biodiversity COP that we have to develop a much more comprehensive view on that too. So we are talking about probably an increase in public money, but in that we do know that we have to broaden the donor base in that. We have a couple of countries who made the graduation from a developed country, from a developing country into the developed country. So you all know what I'm talking about. With the loss and damage at the last COP, we got the UAE as being co-financial partner for the loss and damage together with the German government. So a non-traditional donor moved into it. That is the one topic that is also being a topic also on COP 29. Secondly, we all know that even if we stop every war and stop financing any kind of arms, we need private investment. But private investment is not a question of charity and convincing. I might be very sympathetic for you, but that doesn't change any internal decision of Siemens. And we do know that Siemens is very much engaged in the developing world. The question is, how do we success in designing climate mitigation, and I would say even parts of adaptation, into a business model? That's the task for the 21st century. It must be able, by regulation, by the right incentives, by the right ecosystems in the partner countries, but also in our systems, that investing into climate is part of future business models. That was the idea also for the Hamburg Sustainability Conference that just finished a couple of days ago, where we brought together private sector, financial institutions, heads of governments, and civil society to try to find ways in boosting it. And what does that mean in concrete? In concrete, it means, and you mentioned that already, that, for instance, when we try to redesign the instruments of the financial architecture, that foreign investments, willing investments, are not undergoing very complicated same procedures by any investment. So simplification, we heard, standardization, that are the topics for pushing that forward, and we formed together with the Allianz as a big insurer a so-called Hamburg Sustainability Platform, where we tried to find ways in simplifying the kind of foreign investments into these topics. And that's just one example which we have to boost over the next years, because speed, that was mentioned also, is also a topic, because we have to speed up our processes. Yep. That World Bank and KfW formed an agreement of accepting the proof procedures in the World Bank and then the KfW, to accept the proof process of the other one. That are these topics that we have to push forward. And then we enter a phase where it becomes a business model, and then we get the private money which we need. Otherwise, it is not going to come.
Thank you very much. I think that was very concrete, and it's really about ensuring that at the end of the day, we create business continuity, business investable solutions. So Dr. Marcel, I'm going to ask you one short sentence. What's your opportunity? What do you want to leave the audience with in terms of solution or opportunity that you are seeing right now?
I think the word is work together to a more united world. We are very worried about the pandemic agreement, and we call everyone, every country, to end in this year this agreement, because if it didn't end this year, it's...
Thank you. Yep, that's a great one. Mr. Meyer?
I'm very boring. I just want to repeat what the colleague from Save the Children said: reset for our mindset.
Great. Claire?
And I would say partnerships for sustainable and resilient health systems. And I would also like to call my fellow panelists that maybe we can have a little chat after this session to see how we can maybe tackle some of these challenges together.
Thank you so much. So I will not do justice to this panel if we do not sum it up. I think we have time for a short question. There was one here.
No.
No. Yes, okay.
That's good.
Are you sure only one?
Okay, so it's going to be time for a 30-second question. To do justice to the audience, I'm going to take the question in the very back of the room because people that sit in the very back are the most courageous. Over there, I see a lady there. You have the 30-second question. And then we're going to end it.
Oh my goodness.
Hi, good morning. Sophie Gepp from the Center for Planetary Health Policy. My question would be two questions in one quickly.
30 seconds.
One thing is, how do you engage with the new collective quantified goal from the health angle that is going to be discussed at the COP this year? And then also we talked about public and increasing public funds, and one suggestion both by the governments from Brazil but also by the minister from Germany was about taxation and taxing the ultra-rich. So I wanted to ask, what role can that play in with regard to climate and health financing?
Thank you
very
so
much.
We're so sorry we're not going to be able to take more questions, but I know our panelists will stay afterwards, so we'll take an answer from Mr. Meyer and maybe 2 quick words from each panelist.
Yes, I
answer
can
that
do it
question.
very quick. What I just mentioned about this ecosystem is part of our topic on the new NCQG. So we are thinking about this combining of more private funding in combination with a much more broad and contemporary ecosystem for enabling private investments. And taxation, I can only say and lift my hat to Brazil and to President Lula. My minister supports his view on a billionaire taxation very much because we have to get the money also from them.
Yes. I think of the same thing. We are struggling to make the tax for the billionaire, and the President Lula in the G20 launched the Alliance for Fight Against Poverty and Hunger.
Yes.
And this is the biggest thing that Meyer said. We have a lot of trillions for army and war and no money for fight against poverty and hunger. That million people still die now in the 21st century. By Hungary.
Thank you. I think this was the most eloquent conclusion of this panel. I would like to invite everybody to join me in a warm applause for our panelists. And I'll leave you with one quick thing. You've heard it from Monique earlier. You are all leaders in this room. Please walk the corridors, everything that you can do to mobilize pathways to resilience, to accelerate climate and health financing. You are going to do a service to us all. Thank you.